Hello, I'm Eric Kelly, a GP in Bassetlaw, but also Chair of Bassetlaw CCG. Welcome to our annual general meeting for 2021. I would have liked to have met you all in person, but because of the ongoing COVID pandemic, we're having to do our AGM, a bit like last year, virtually. Today, as well as hearing from me, you're going to hear from some of my colleagues. You're going to hear from our Chief Financial Officer, Hayley Tingle, talking about our financial duties and responsibilities. Our Chief Nurse, Nicola Ryan, talking about nursing issues and what we as a CCG do to support quality in everything that we do. And also from my Chief Officer, Idris Griffiths, who will give an overview of everything we've done over the last 12 months. And at the end, Idris will explain to you how you, members of the public, can ask questions. I'm just going to start off by giving a little bit of background information in terms of our targets and our responsibilities. Now, as you know, the COVID pandemic has been with us for 18 months. But as a CCG, we are committed to continuing to provide the best support we can do for our population. We're committed to ensuring high quality and safe services. We are committed to looking at the wider determinants of health. I've been working with partners, including the District Council, to actually look at what we can do to support our young people, including building a new educational facility in Worksop. We continue to work with partner organisations to see how we can integrate services outside hospital. As well as working with our hospital, we appreciate that the best place for patients isn't in hospital, but in the community when it's safe to keep them there. We've also expanded our community mental health services. We've had public engagement exercises to actually see what we can do, and actually we're investing over £4 million to support this area of work. We're also working with our member practices to see what we can do, not only to strengthen the resilience and sustainability of general practice, but also supporting GPs to work remotely when needed, and actually supporting GPs in the rollout of the COVID vaccination programme. Thank you.
Hello, my name is Hayley Tingle and I'm the Chief Finance Officer for Bassetlaw CCG. I'll take you through a very high-level summary of our 2021 financial report and accounts. The first thing I wanted to report to you is that we've achieved all our financial duties in 2021. We received just short of £200 million to commission services for the population of Bassetlaw. Our duties include keeping expenditure within our funded allocation, keeping our administration resource within our funded allocation. These are the costs we incur to run the organisation. It includes staffing, our governing body, and the organisation's overheads, including premises. We received an unqualified clean audit opinion for our annual accounts from our external auditors and was commended on the quality of our annual accounts. We have achieved our Better Payment Practice Code target, which means we pay on time to our providers and our suppliers. We also stayed within our cash limits, both at the bank and also the cash limits we are set by NHS England. The next slide demonstrates how we spend our money. We are allocated £199 million to commission services for the population of Bassetlaw. I'm going to talk around a few of these areas, however the graph demonstrates where all of the money is spent in Bassetlaw. We spend just over half of our allocation on acute hospital services. We spend the majority of this with our main provider, which is Doncaster and Bassetlaw Teaching Hospital Trust, but we do commission from other acute hospital providers within the area. The next biggest area of spend relates to primary care, which includes our GP practices and the drugs they prescribe. We spend just over 23% of our funding, which equates to £45.9 million. We spend about £20 million of resources on mental health services, and we achieve the National Mental Health Investment Standard. Finally, our running costs represent just over 1% of our allocation. Looking forward, 2021 has been an incredibly difficult year. We've had a new financial regime which has continued into 21-22. We've had directed contract values with NHS providers. These have been calculated at a national level and directed to us by NHS England. This has continued into 21-22. We know we've got a significant backlog of demand, which has created significant waiting lists in services due to the pandemic, which will be incredibly challenging to deliver. Although we've maintained the mental health investment standard, we know the significant challenge and demand relating to mental health due to the pandemic. The temporary financial regime has resulted in lack of flexibility in investments and the ability to redesign pathways. We know this is going to be difficult in our ability to deliver more efficient services going into 22-23. The opportunities and challenges from both the boundary change and the Integrated Care Board will need to be worked through and considered. However, it is clear a joined up and collaborative approach will be the key to how we can meet the needs of the population within the funding we've been allocated. Thanks for listening, and a copy of our accounts and annual report can be found on our CCG website. Thank you.
Hello, I'm Nicola Ryan. I'm the Interim Chief Nurse at Bassetlaw CCG. I'm just going to give you a presentation on what the nursing and quality team have done during 2020-21. And obviously it's been a really challenging year for us from a nursing and quality perspective, and we've tried our hardest to continue to deliver quality services across Bassetlaw. So the main things we've got in place, we've got an established quality and nursing team, and that team has remained in place during the last year, and that supports a Quality and Patient Safety Committee, which meets monthly and considers all the quality and patient safety issues that arise from ourselves and our partners across the Bassetlaw system. We've continued where possible to quality monitor provider services. Some of that has been done virtually, and some of that has been done by us attending premises where it's been safe to do so during COVID-19, or where there's been an urgent clinical or quality concern that we've needed to visit the premise. Quality and patient safety is an essential role of the governing body members, and they receive regular reports at all governing bodies around key issues and areas of success. We continue to work in partnership with Doncaster CCG, particularly around the quality of services at Doncaster and Bassetlaw hospitals, where we share the service. So, key things that we've done during 2021, from a continuing health care perspective, we've achieved all the national targets, and where possible we've resumed normal business, and that was from the 1st of September 2020. All patients that were discharged from hospital from the 1st of April to the 30th of August, we had to assess and agree future packages of care based on the National Discharge Scheme, and then get them onto the appropriate funding pathway. The total of patients in that was 375, and all were assessed in the required period of time. During COVID-19, our existing continuing healthcare patients, joint funded, and patients receiving FNC received their annual reviews during that time to ensure that their care was not compromised during COVID-19. From a personal health budgets perspective, we continue to go from strength to strength, and we offer personal health budgets across a wide variety of services. And at the end of March 2021, we had 234 active personal health budgets, and they were maintained during COVID-19. From a transforming care and learning disability perspective, the CCG was the top CCG in the country for the delivery of annual health checks. 92% were completed, by the Bassetlaw GPs during that period, and it was a tremendous achievement in view of the COVID-19 challenges and meeting with patients and residents. We also launched the CCG LD strategy, and that's available on our website. And we commenced a new acute liaison post into the CCG, who's working now across the health community, including into the hospital, where people with a learning disability are admitted. From a children and young people's perspective, the CCG has continued with its transitions work, and during the last year we developed a transitions booklet and a film which was published in spring 2021, and both are available on the CCG website. The film has been well received by other organisations, both in South Yorkshire and Nottinghamshire. And we've worked and evolved the transition steering group into an assurance group, and we've continued to progress monitoring and supporting young people into adulthood and adult services. The priority has continued for safeguarding adults and children, and we've developed and implemented a responsible commissioner pathway for care homes of significant concerns, and this was enacted twice during 2021. The pathway is supported and communicated with other organisations outside of Bassetlaw who had residents placed in the premise of concern, and worked really well, and has been shared with other CCGs. We launched the ICON project, which focuses on It's Normal for a Baby to Cry, and You Can Cope programme. Again, available on the website for anybody that wants to look at that work. And again, we were key in leading on that piece of work. We've also implemented a local pathway for the court of protection cases that we've been seeing during the COVID pandemic. Care homes were particularly challenged during the last year due to the impact of COVID-19. We continued to work collaboratively with Nottingham and Nottinghamshire CCGs and the local authority to support the care homes. That included weekly teleconference and video conference in with the homes, so we could update them and support them with challenges. We also developed a home care provider meeting as well, as we recognised that this was another aspect of care that was severely challenged during COVID-19. And we worked well into Nottinghamshire around all the care home strategic planning, delivery of vaccines and PPE. Key to this was the work that our infection prevention and control team did during the pandemic. We have a dedicated team, and we were able to add in some additional resource, and the nurses and the team covered 7 days during the initial parts of the wave 1 of the COVID pandemic to support particularly the care homes who were having troubling times and needed to respond to national direction and delivery of guidance which continually changed. The infection prevention control team were also successful in delivery of the national PPE donning and doffing training, which was delivered to all care homes and home care providers within the national timescales. This involved the nurses visiting care settings and delivering training outside, so with staff watching through the window, often in inclement weather at times. But it was really successful and well received by the care home sector. During all this time, there was management of outbreaks, predominantly due to COVID-19 across the Bassetlaw community, so additional support, advice was provided by the team. And in the initial stages, the team were interpreting national guidance relating to PPE, visiting, and anything else that related to infection prevention and control. It's been a challenging year for the team, but they've been able to continue to monitor quality, ensure that patients and residents in our settings have had safe, effective care, and they're a credit to the CCG. If anybody would like to ask me any questions or contact me, the details are on the slides that are included.
Hello, thank you for listening to our AGM with this video. I'll give you details at the end about how you could contact us or ask any questions. So my name's Idris Griffiths, I'm the Chief Officer at Bassetlaw CCG. First of all, I wanted to tell you a little bit more about our partnership arrangements and the collaborative working that we have in Bassetlaw. This has stood us in really good stead, as you heard earlier, during the whole of the COVID pandemic. It's built on strong foundations. Our Integrated Care Partnership Board has a number of stakeholders represented at the most senior level. So the District Council, the County Council, the Community and Voluntary Service, who played such an active role, not just in our partnership, but the response to the pandemic, and the healthcare organisations, including Notts Healthcare and Bassetlaw and District Hospitals. We've been working with colleagues as well across South Yorkshire. So, for example, with our response to the vaccination programme, but also to trying to respond to the increase in the number of patients that unfortunately have been waiting for elective surgery. That has used both the independent sector, but we've worked together with the hospitals to ensure that we increase our elective activity as much as possible. Probably most importantly for us, our primary care colleagues who've excelled throughout the year since this calendar year on the vaccination programme, responding absolutely brilliantly in terms of vaccinating people across Bassetlaw so quickly and so effectively. But I also wanted to pay some attention to our own staff within the organisation. You've heard from our finance and nursing and quality teams, and overnight they transferred their working to remote working from home predominantly. In addition to that, some of our nursing colleagues, for example, the continuing healthcare colleagues, but also our excellent infection prevention and control team have been on the ground, coming into work throughout, providing support for the distribution of PPE and for care homes with training and advice throughout. But also we've got our transformation team, and they work to improve healthcare, to work with our providers to improve pathways and improve the outcomes for patients. And they've been really pivotal in areas such as the urgent care response and for discharges. So our staff, I've been proud to lead throughout this period and throughout the last financial year. And I think they've behaved and performed in a truly outstanding manner, working shoulder to shoulder with colleagues throughout the Bassetlaw community. And of course, it's not just been about COVID. We've continued our normal business as much as possible. We've continued with our governing body meetings, with our quality meetings. We've continued to support people with learning disabilities, supporting children and safeguarding. So all of these are the essential services, not directly COVID related, have continued as much as normal as we possibly could. Looking forward now, we want to build on these collaborative and partnership arrangements. We want to ensure that the community spirit is something we continue to harness across Bassetlaw, continuing to support the community and voluntary sector, and continuing as well with targeted investment, including our £4 million investment programme in mental health, which is going to be so essential going forward, particularly in areas such as children and young people, in suicide and suicide prevention and support, and for postnatal care and for crisis. So we are proud to be able to increase our investment in those areas, and the timing of that we feel is incredibly important. But the future also brings quite significant change for us within the Clinical Commissioning Group. Next year we expect the bill that's currently before Parliament to be passed, and that will disestablish the Clinical Commissioning Groups and replace them with larger integrated care systems. But in addition to that, in Bassetlaw, it means a change for us from being part of the South Yorkshire and Bassetlaw integrated care system to the Nottingham and Nottinghamshire integrated care system. This will mean that we'll be able to work even more closely with Nottinghamshire colleagues, particularly in areas such as adult social care and children's services and so on. So we welcome that opportunity, but But obviously it's a significant challenge for us to change systems from one year to the next, in addition to disestablishing the CCG, and also changing from one NHS region to another. So this will be our last annual general meeting in our current form. But as I said at the beginning, we've built up and been part of strong collaborative partnership arrangements. And the work that our staff do will continue, but within a different organisation. All of the benefits that we've seen during COVID, but also apart from and outside of the direct response to COVID, will continue, and I envisage a very optimistic future for those partnership arrangements. Bassetlaw within that will remain with its distinct identity. Patient care won't be affected, pathways of care and referral patterns will remain as they are, and patients will still have the choice to attend the hospital that they want. In addition to that, we hope that we will see the commencement of the capital programme at Bassetlaw District Hospital this year, which will see a really impressive improvement to the urgent care facilities within Bassetlaw. So having heard the presentations for our annual general meeting, if you have any questions or any issues that you'd like to raise, please contact our email address, which we'll be showing at the end of this presentation. Thank you.